Hello, I'm John Kunihiro from Art of Feeling. On my left over here is Michael Sakowich, or licensed acupuncturist and massage therapy, but he does more in the modality in dry needling and manual therapy. But he's a pretty amazing therapist. Been working for us for 5 years, great experience, and we want to know, introduce to you guys what he does and have a little bit more understanding about his techniques and other stuff. Michael, tell a little bit what you do.
Okay, well, I do a lot of acupuncture and a lot of acupuncture techniques. So dry needling, I mean, we call that an acupuncture technique. That's kind of what it was taught to me as years ago now. But yeah, I started off as graduated from acupuncture school 2005, and honestly that time I didn't really consider myself that good at acupuncture. I thought I would just do massage and give people herbs because I felt really good about that. But over the years I learned I had some really good mentors that spent a lot of time in China and Japan, and they taught me a lot of great stuff pertaining to acupuncture. And and that's kind of where a lot of the dry needling stuff comes from now, and then a lot of things of, whatever, the more gentle stuff that I do that's pretty powerful.
Michael, can you explain a little bit what acupuncture does and what's his side effect and everything?
Okay. Well, let's just talk, so acupuncture, there's a lot of ways to do acupuncture, and I think a lot of people, when they pick, like if you haven't had acupuncture, or most people in America have had like a certain type of acupuncture where, somebody puts a bunch of needles in you and then you just kind of get relaxed and you kind of fall asleep or take a nap or space out or something like that. And I think that if you haven't had acupuncture and you just seen it on like some movie or something like that, there's like a million acupuncture needles and you're like, oh God, that looks terrible. But ultimately, it's really, it's a very relaxing situation. It's usually not too many needles. Like most people that I give acupuncture to, just acupuncture, we're talking maybe 10 or 12 needles. And, the needles are super fine. I mean, they're like, I don't even know if you'll be able to see them, see how fine it is, but it's like, does that even come up? It's super, it's hair thin, and these are all like always brand new needles. Anywho, you don't really feel it go in. It's just, you just lay there and you relax, and you really get into an interesting mental state when you get acupuncture. But I learned acupuncture at Southwest Acupuncture College, graduated 2005, and then after that I learned other acupuncture techniques. I did a postgraduate class with just all these different types of acupuncture techniques, and they're all strictly from China, and there's lots of, it's very different from most people's perception of acupuncture, because we're actually trying to, in a moment, stimulate something, right? And in some of these acupuncture techniques, we're trying to stimulate the channel, maybe to get like, if you have really bad stomach cramps or something like that, you can do a needle in the leg and do a certain type of technique and make those stomach cramps basically go away, which is pretty cool. If you're like really in a lot of pain and you can make that happen, that's really neat. But also, we learn a lot about, basically what's called dry needling here in the States, and this stuff, the Chinese have been doing this for God knows how many years, like a similar enough technique that physical therapists call dry needling, they've been doing in China for at least 1,000 years, if not, who knows, it's sort of hard to tell.
And what's the big difference between this dry needling that way, these techniques you're talking about? Because actually what I see, and I visit a lot of clinics, because that's what I like to have a little bit of feel to understand more and more, is the difference between the dry needling and acupuncture. And I don't see many acupuncturists do that because it's very fine. That's how you said you took a post-graduation classes. and it's very, to understand that you need to have a little bit more of the depth of the knowledge that you have. And like you mentioned before, you have a lot of knowledge of anatomy. We discussed about that physiology, and this kind of thing you need to have knowledge, because you cannot just insert it and hit the nerves and be like, oh, this is not good. But just explain a little bit to the people's listen about this. Different would be the technique, or what's the feeling, what it is.
So I think that when we do this, dry needling technique, as we call it in the West, PTs call it dry needling. I'm looking for, like you have a shoulder problem. So I'm going to look, I'm going to go, okay, what's that? That feels tight there. That feels like tight things. And I'm looking for trigger points that are like in the muscle. I'm looking for I'm trying to discern very carefully where the muscle is like stressed at. Okay. And then the needle goes into that point of, we'll say, stress. And the needle technique that we use gets that muscle to release and fire, because that muscle is like really tight and it's basically guarding. It's like when you're, let's say you're walking down the street and maybe it's raining and you hit something that's really slippery, you have a slip and fall, you're gonna pull all types of weird muscles, some muscles you didn't even know you had, right? And a lot of times those muscles don't just get better by themselves. You need help, you need assistance. More often it's like somebody's working out really hard, you're super into your workout or your tennis match or whatever, and you overexert yourself and you're just and you pull a muscle. So what that's happening is your muscles basically trying to keep your structure from really coming out of line, so you don't like hurt a tendon or ligaments and all this stuff. So it's sort of a defense mechanism, but your body, your mind, your whole brain and physiology, nervous system keeps that muscle guarded. And so, dry needling will go in and it sort of breaks up the feedback system of your brain, telling that muscle to guard itself. And then it also goes into the muscle and gets the muscle release and that muscle response, so that muscle is nice and smooth and gets better blood flow. And so it's so you can kind of have that full mobility of whatever we're working at. Because that's, when you have pulled muscles, you don't move that well, because you're in a lot of pain usually.
And what I understand is actually the therapy itself, you could feel more than acupuncture. However, the effectiveness is much quicker because you actually work directly on the point that is being injured.
Correct. Yeah. So here's a good story. So let's say, I was 5-6 years into my acupuncture career. I had this one guy. He had a knee problem, wouldn't go away. He just had his knee was just really inflamed, really painful. I would do acupuncture. I would do something called moxibustion on him. I would do Easton acupuncture on him. He'd feel better he'd walk out of the clinic, feel great. 3 days later, he'd be right back, almost the same amount of pain. And so I treated him for 4 or 5 weeks, same thing, twice a week. And it was just bam, 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 constant. All the while I was taking this course, right, that we were talking about earlier, and started learning this needle technique, and I was like, well, let's give it a go. Mm-hmm. So I started working on this guy, and so when you do acupuncture, it's really passive. You are kind of, you're getting flow, you're decreasing inflammation, you're getting all those feel good hormones going in your body. So you for a couple of days you don't feel it, you just feel good, right? And you don't have any repercussions. But when you do dry needling, that I'm doing something. It's very obvious that I'm in the belly of your muscle. The muscle's responding. Yeah, it releases that really tension. It's releasing. It's obvious that it's releasing. So it's not always like this wonderful, comfortable, fluffy feeling that you get from acupuncture. But I am more concerned with how you feel next week, next year,
Well, next day even, yeah.
Well, the next, yeah.
Yeah.
But, it's more like when you go in and you really treat the root of the muscle, like really get to the core of that muscle and that dysfunction, you can change it with dry needling. Where acupuncture, rarely, you just can't really get to that depth and that, root of it, So it's pretty profound, but at the same time, yeah, it's usually when people, if they've never had this type of work, I'll go, okay, well, let's start slowly. Let's see how you do with it, and because I'm not gonna start doing, 20 sites on your leg if you've never had this stuff before, It's like we go nice and slowly and, kind of read the situation, you gotta read your room and make sure that everybody's, like comfortable with what's happening. So you're not pushing anybody too far, because everybody has different comfort levels, because this can be a very intense medicine, intense type of therapy, let's say.
Right.
And then some people are just like, whatever, this is no big deal, have at it, because they immediately understand what it's doing in their body, and they're just okay with whatever that is. And they're like, just go for it. I'm tired of this pain. Let's work it out.
Yeah. And that's one of the amazing part is that I see Michael working, he worked on me before and have lower back pain or knee issues, and I always come to see him and recommend a lot of people for those immediate respond to people who wants to have this injuries lingering for a long time, and I see the results comes and they see immediately release, and it is immediate release a lot of times. I don't say it sometimes could be immediate results, but the immediate release is a good thing. And what's the difference we offer here in Art of the Feeling is that that's a very unique technique, is he's just not specialized in that, but he actually see the results, and only that, he's teaching other therapists to do so here even in our clinic. And I see the growing on this in the field, because he's very confident in what he does and he can read your body. It's not like what he said before, he comes and they just put the needles there, okay, oh, I don't care if you hurt or not. Actually, he's just sympathetic with you, empathetic about it.
So they know exactly how it feels.
Exactly. And he's been doing for 16 years. It's not the experience to tell a lot of things. And that's the unique things about us, is that you don't need to be scared. Even if you're scared of needles, I don't like it, I don't like how I feel, I don't like to see it, I faint it. And we actually properly treat you how you are, and with your fear and everything. And sometimes it's just like, but one needle, and I say, let's work on you with my hand, let's do some manual therapy. And that's how we are careful with you, each person. That's what's great about acupuncture and dry needling, is that it's very unique how we work. It's not, each person comes and it's a different type, heights, and race, it doesn't matter. It is, we work on yourself, your soul, your spirit, your body.
Yeah.
Tell me a little bit, what, if people want to come to see you, what kind of ailments they usually comes?
It's kind of a tough question in a way, because I would say that it kind of depends on where I'm coming from, right, or where I'm practicing. So in Atlanta, I see a lot of like sports medicine stuff, or people that are like middle-aged, like we might be, and trying to be athletic, trying to just be healthy and keep a good lifestyle. And we all kind of mess ourselves up, like muscle strains. Maybe we ran too hard or biked too hard or doing yoga too hard, like all this stuff causes muscle strains. So I get a lot of that. I get a lot of people with anxiety and just weird, not sleeping well, especially now because our schedule is just so weird because of COVID, and we're stuck home all the time and we're not be able to talk with each other. So,
Right.
So people have a lot of like weird emotional things happening that they're not used to. And so, so we're doing a lot for that. But before I worked here in Atlanta, I worked in Providence, and I saw mostly internal medicine. So I would treat people with a lot of digestive problems, heart problems like arrhythmias, all types of things that you just maybe most people wouldn't expect acupuncture to be able to handle, but it actually does quite well.
Right. That's mean you can work more internally and externally, that musculoskeletal area, and as well the vital areas like the heart problems and even emotional components. And I think that's amazing about like acupuncture is how much you can bring this together with a natural way. And can you explain a little bit to the people who's listening to us this is how you can help that? It is very, very ample to say that in one term, but tell me a little bit about what acupuncture would help somebody emotionally in distress right now.
Okay. Well, I would say that, as a grand, the best way to put it is that acupuncture, a byproduct of acupuncture, side effect, is that it just relaxes your nervous system. So if you're not even working on it and you get acupuncture, your nervous system gets chilled out. You get endorphin release, like all your happy hormones are released, dopamine, all this stuff just starts flowing better in your body. So without even really trying to like attack something or trying to smooth out the emotions, whatever, you just get that as a side effect. And then if you really want to focus on it, then we're looking at, different, what we consider, all the organ systems in our body have emotional components to them, and that comes out in different ways. And a lot of times stress can affect your liver, or makes you start thinking too much, so that affects your digestion, or maybe it's affecting your heart now, and then each organ, let's say, you're thinking too much and you're overpensive, we'd say, and that starts to really hurt it sort of takes all this energy from your digestive system because you're constantly on your brain, and then it sort of weakens. And then other organs will come in and start like what we consider almost insulting that and making things worse. And then people start getting really irritable and angry, and you're like, wow, what's going on here? And it's just because they just are thinking too much and it like hurt their body. And so we fix that.
Oh, that's great. Can you tell a little bit of the one success story about that, like people like can hear like, wow, this is you're changing the person.
I've seen this, this is something that doesn't happen every day, but often, it happens where it's like, it happens regularly enough where something happens in their life and they get really out of sync with life. And they feel like off, maybe even confused about, what's going on. They just don't feel themselves like that. And that's what they'll say. I just don't feel myself anymore. I don't know what happened. And something happened, 6 months ago, I had a car accident, or I had a, fight with my husband, whatever. And then I haven't been the same since. And then so do acupuncture, and then sometimes after one session, it just snaps them out of it. That's rare, but it can be like that is something that does happen often enough, like worth mentioning. It's more often where people come in feeling maybe that way, and then after a few weeks of regular sessions, then they'll start getting, okay, I'm sleeping better than I have been, and I just feel better about my life, and just not thinking about all my stresses all the time.
That's a very good success story. Actually, I have one to add over here. I see one lady, she come with a wheelchair. She has a stroke.
She had a stroke, yeah.
She had a stroke, and her husband brain. And it's very hard on her daily life, but she came with a wheelchair. Now, she's not completely off, but she's able to walk now after several sessions with acupuncture with Michael. And this is very rewarding for you, right? To see just think like you see from ground zero, the person just came like so disabled, and it's something like, wow, this person, you changed the people's lives.
Yeah. And now she can walk a quarter mile a day is what she's up to, which is pretty cool, from being wheelchair bound.
And Michael is very special person. We have him for a while, and then we want to keep for a long time because this relationship we have is just much bigger and deeper because he really cares. Michael, thanks so much.
Thank you.
And I totally trust and believe that you guys can, have the best treatment, the elite treatment with him. And this is a word from me because I will tell you, he helps so many people, and he can make a difference in your life.